Good morning. First of all, I would like to thank the organizers for inviting me to this patient congress. I feel very honored to be here with you this morning. And we're going to talk about lupus and the heart. What are the risks and how can we lower them? And in this slide you can see on the top the library of the National University of Mexico, my university, and then you can see the ABC hospital, my place of work, my current place of work. Well, the heart is a target organ in lupus, in systemic lupus, and all the cardiac structures can be involved. We can have pericarditis, that is inflammation of the sac that surrounds the heart. We can have myocarditis, that is inflammation of the muscle of the heart. And also we can have endocarditis, that is the inflammation of the inner walls of the heart. But also we can have a coronary artery disease, that is the narrowing and hardening of the coronary arteries that you can see in the slide, that moves the blood to the heart. Today we are going to talk about coronary artery disease because it is a preventable, and I'm going to repeat that, it's a preventable major cause of illness and death in lupus patients. Patients with coronary artery disease may have angina, that is chest pressure with exertion or exercise that goes with rest, or may have a heart attack. With the rare exceptions, all heart attacks are caused by atherosclerosis. But what is atherosclerosis? Well, atherosclerosis is this narrowing and hardening of the coronary arteries resulting from fatty deposits, cholesterol deposits in the vessel wall. This is an inflammatory process that narrows the lumen of the artery, giving a reduction in the blood flow to the heart. And you can see that in that coronary artery with this atherosclerosis. In this cartoon, you can clearly see how it's this process through the years, let's say. First, you have a normal section of a normal artery, and then this atherosclerosis begins with a tear in the artery wall, then fatty material, cholesterol material that you can see in yellow is deposited in the vessel wall, and finally the narrow artery becomes blocked by a blood clot, causing a heart attack. Atherosclerosis and its sequelae, myocardial infarction and stroke, are a major cause of morbidity and mortality in lupus patients. However, early detection may provide an opportunity for therapeutic intervention. There is an increased risk of coronary heart disease in systemic lupus. But what's the magnitude of the problem? Look at this. In lupus, women between 35 to 44 years have a 50 times greater chance of having a heart attack than women without lupus. This increased risk actually is multifactorial and cannot be solely explained by traditional risk factors. There are additional factors coming from lupus itself and also from the treatment that increase this risk of coronary heart disease in lupus. Let's go to review all these factors. Traditional cardiovascular risk factors comprise risk factors that cannot be changed, other factors that can be changed, and also protective factors. These risk factors that cannot be changed are age, gender, and heredity. There's no way to change that. But here you have listed the risk factors that can be changed. That means that we need to work on these factors. We need to be proactive in managing these risk factors. And these are high blood pressure, elevated serum cholesterol, cigarette smoking, obesity, glucose intolerance, diabetes, and behavioral factors that we're going to discuss. Beginning with high blood pressure, let me say that hypertension is the single most significant risk factor for heart disease. And as you may know, it is called the silent killer because it has no symptoms. But there are some ways that you can lower this blood pressure, simple actions like weight loss, salt restriction, and exercise. All these may help to lower this blood pressure. And also, if needed, they are very well tolerated antihypertensive medications that your doctor may prescribe if you need that. What about lipid problems? I'm not going to talk about lipid problems because Dr. Bonfà is going to talk maybe tomorrow about this. But let me tell you that cholesterol is a part of a healthy body. However, if you have high cholesterol in the blood, this is a risk factor for coronary heart disease. But there are simple measures that you can do to keep cholesterol under control. This is having a diet low in saturated fat and cholesterol, reducing alcohol intake, regular exercise, and stop smoking. All of this will help to keep cholesterol under control. And in addition, if you need, there are cholesterol-lowering drugs that may your doctor may prescribe in case you need that. Well, all of you know that cigarette smoking is a major contributor to cardiovascular disease. It is the #1 risk factor for sudden cardiac death. But fortunately, the risk declines as soon as smokers stop. But you may ask, how can one stop smoking? Well, yes, quitting smoking is one of the most difficult things a person can do. But you need to make an agreement with yourself to quit. Ask your healthcare professional for information and programs that may help. Keep busy doing things that make it hard to smoke. Reward yourself when you quit. And very important, ask your family and friends to support you. Just a few words about this problem that is one of the major public health problems worldwide, and this is obesity. Obesity is a major independent risk factor for heart disease, and in addition, it can predispose to other risk factors like hypertension or diabetes. In general terms, there are two types of obesity. What is called the apple shape, where excess fat is found in the abdominal area, or the pear shape, where the excess fat is around the hips and buttocks. The apple shape is the one that has been related to coronary heart disease. But independently, if you are an apple or a pear, you need to weight loss. And it's a matter of balancing healthy eating with a healthy level of exercise. A healthy diet and lifestyle are the best weapons you have to fight cardiovascular disease. It's important to remind that plenty of food doesn't mean getting the nutrients to be healthy. Nutrient-rich foods have vitamins, minerals, fiber, but are lower in calories. Thus, a healthy diet is the one that helps maintain or improve health. And this healthy diet is plenty of vegetables, fruits, whole-grain products, fat-free or low-fat dairy products, fish, especially fish rich in omega-3 acids, like salmon, trout, herring. And 2 more recommendations. Reduce trans fat in your diet, and this is the one that you can find in margarines, for example, and prepare foods with little or no salt. Behavioral factors can be changed. It's difficult, but it's possible. And we are going to talk about 2 things. The type A personality is the personality that has been related to coronary heart disease. And this personality is characterized by a sense of time pressure. People with this personality are always in a hurry. They have chronic impatience and also excessive hostility. You know many of them, I'm sure. What about the stress? Some stress is normal and even useful, but if stress happens too often or lasts too long, it can have bad effects in your body. But the good news is that you can learn ways to manage stress. And for example, meditation, relaxation, listening to music, all this can help you to manage stress. And also there are stress reduction techniques that you may learn. Yes, you can cope with stress. Remember that outside events can be upsetting, but it is how you react inside that is important. Try to learn to accept things you cannot change and engage in physical activity regularly. This will help you. You can live a more relaxed life. Be positive, not negative. Learn to say no, don't promise too much, and give yourself enough time to get things done. These are simple things, but effective ways to have a relaxed life. And always think positive, or at least try to think positive. We said that there were factors that cannot be changed, others that can be changed, and also protective factors. Let's talk about these protective factors. Among the most important are the good cholesterol. This is the high-density cholesterol that I'm not going to talk about that because, as I told you, Dr. Bonfa is going to talk about lipids. Exercise and moderate alcohol intake. Regular exercise will help you to decrease the likelihood of a heart attack, but you need to check with your doctor before you start. Regular exercise has a positive effect on other risk factors. It lowers blood pressure, it increases the good cholesterol, and helps to control blood sugar, stress, and body weight. What about exercise? The current recommendation is to exercise 150 minutes each week. But don't panic, you don't have to do it all at once. A 10-minute brisk walk 3 times a day, 5 days a week, will give you this 150 minutes of moderate intensity activity. That is the current recommendation. But remember that the simplest positive change you can make to have heart health is to start walking. It's enjoyable, it's free, social, and it's a great exercise. So what about alcohol? Alcohol, and especially red wine, in moderation, 1 or 2 drinks a day, may protect against coronary heart disease. However, the association is not strong enough to recommend that people that are non-drinkers take up alcohol consumption. But, yeah, right. But if you have 1 or 2 drinks a day, that's okay for your heart. But remember that drinking 4 or more drinks can have deleterious effects. Well, we said that not only these factors, the traditional risk factors, account for the high risk of coronary heart disease in lupus. There are also lupus-related factors. This is systemic lupus erythematosus-related factors that increases risk. And which are these factors? The most important are premature menopause, chronic renal impairment, inflammatory mechanisms during the flares of the lupus, and the presence of antiphospholipid antibodies. And you are going to talk a masterpiece talk tomorrow with Dr. Hughes about antiphospholipid antibodies, that are antibodies that increase the risk of having blood clots. But in addition to lupus factors, there are treatment-related factors that also increase this risk. Corticosteroids, on the one hand, may protect from coronary heart disease by controlling inflammation. But on the other hand, they contribute independently and through accrual of traditional risk factors to this cardiovascular risk. And azathioprine, this immunosuppressive medication, also has been associated in some studies to cardiovascular risk, but this needs to be studied more. No, it's not a conclusive thing. Well, in summary, how can you make your lifestyle healthier? Following these recommendations. Don't smoke, have your blood pressure checked regularly, improve your eating habits, be more physically active, maintain a healthy weight, learn stress reduction techniques, have regular medical checkups, and take your medicine. The take-home message is that you can help reduce your chances of coronary heart disease if you control the risk factors that we have talked about. Avoid factors that activate lupus, for example, sun exposure. And if you talk to your doctor about your cardiovascular risk and how you can do to reduce this risk. And remember to laugh. Lotteries may indeed be the best medicine of all. Thank you very much.
Good morning, my name's Eileen Fraser. I'm just wondering, if you have lupus, does the MI manifest itself in the same way as a regular MI happens? Do you have the same signs and symptoms? What are the signs and symptoms if you have lupus of having a heart attack?
A heart attack is characterized by pressure on the chest, pain on the chest. You can have shortness of breath. You can have fainting, many things that are just, you can have left arm pain or jaw pain. Mm-hmm. All these are more related to a heart attack than lupus itself.
Yeah. If you have lupus, though, and you're having a heart attack, will it manifest itself in the same way?
Exactly the same way. Okay. Exactly the same way, yeah.
Hi, I'm Sandy Ingham. I would just like to know, is there a way we can control whether we're a pear or an apple? What are the factors that cause abdominal weight gain and
Yeah, well, there are many factors. There are genetic factors, but the most important are related to insulin resistance that gives you this apple shape, insulin resistance. So you need to check that with your doctor. This metabolic syndrome, the insulin resistance.
Okay, can exercise
help reduce sure, absolutely. Absolutely. Exercise is the recommendation for that. Yeah. Well, thank you very much. Thank you very much.